Hi everyone, Steve Gonzer, physical therapist and chief analyst at RunSmartOnline.com. And this article may not seem like as sexy as some of the other things I've done where I talk about how you can get faster, how you can beat injury. But this is super important for when you're trying to recover from injury. And if you're not even injured now, you're going to want to heed the advice I have because it can really make a difference, not only for you when you're trying to do things yourself, which most people try to do is they try to just Google everything, or if you're working with a clinician who can better interpret where your symptoms are really at. And the biggest piece here is deciphering pain. Okay, so when a patient comes in and I'm talking to them and they get really annoyed because they'll say it hurts, and I got 1,000 follow-up questions to figure out, does it really hurt or do they just feel it? Because that's going to make the difference between, are you ready to continue to keep running or keep progressing your exercises, or do you need to hold off? Pain is a sign of inflammation, is a sign of breakdown. It's real easy when you cut yourself to see, oh, it's not healed yet. But when something's on the inside, it's very difficult to understand, is that tissue healed? And following the advice in this article that I posted, you can start to understand what I go through in my mind when I'm determining, is someone ready to progress their exercises or do they need to hold back? And really the key difference here is, does it hurt or do you feel it? Feel it is just a sensation that it doesn't hurt, but I'm aware of it. I know it's there. It doesn't hurt. And that is the key thing. And I want to show you a quick video on why that's so important to understand from a cellular or a tissue level at the muscle, tendon, or joint. Okay, so what I'm about to explain is something I talk about with my patients every single time we're dealing with an injury, or nearly every time. And it's the basis of most injuries in runners. And let's take the calf, for example. The calf pulls, but it needs to withstand tensile force. So if it pulls too hard or gets pulled too hard in each direction, you can understand, I hope, that the calf would separate, the muscles would separate. Now, if we were to microscopically look at the calf, all the muscle fibers, and this is true for all muscles, the fibers should be running parallel with each other, running all the way down. And you can see that if you look closely at the calf, you see these little strands of fibers running in each direction. What happens, though, is when you come in and you snip that, because the muscle can't withstand the tensile force, is that the body comes in, much like if you were to take a piece of chicken and cut it with a knife, the muscle would open up. Well, the body comes in and fills that dividend with scar tissue. So it was once normal, nice parallel tissue starts to look something like this. As I draw these arrows or these other lines in, things don't look parallel anymore. They're haphazard. They're all over the place, and this is scar tissue. Now, to get yourself back to normal tissue, you can't just go in and work the muscle too much. If you come in, because scar tissue is weaker than normal tissue, if you come in and just start running too much, running too hard, and you start to have pain, essentially what you're doing is you're putting a lot of load to the injury site, and it'll eventually just rip itself apart, and then the process starts all over again. This is where the importance of it between feeling it and it hurting. If you feel it, you're not doing enough damage to rip that sucker apart. All you're doing is loading that injury site. But if you pull too hard and it becomes painful, you're destroying the site. To get this injury to turn into new parallel tissue, you need to load it and you need to do stuff. And it will eventually, over the course, we know it can take up to 6 months to fully remodel an injury or remodel tissue. The fibers will find themselves back to being parallel. But for you to get from this to this, you have to do stuff. If you don't do anything, let's say you just sit on it, this will stay as scar tissue. Your body responds to load. What you need to do is the right amount of activity, the right amount of running to slowly re-engage to turn that to new tissue. If you do it properly, it'll happen, but you have to get there. Too much, you break it apart. Not enough, and it stays as scar tissue. So be patient, but know that there's a huge difference between pain, which is you're re-tearing, and feeling it, which means you're just loading the weakened spot. So as you can see, we're trying to get that tissue to remodel to all get back in the same alignment, and it takes a while to do that. When you're running, when you're exercising, you're doing things and you're just aware of it, you're just working through that process. But what you can't do is go and rip everything apart by going too hard, too often, or whatever it might be. So be smart in your injury rehab. Definitely use a clinician that can help you. Don't try to do things yourself. And follow these rules between feeling it and pain, and you're definitely going to get back on the road sooner than you would otherwise.